hello, check, 1 2, hello, check, 1 1 2, hello, check, 1 2, hello, check, 1 2, hello, check, ठीक है?
Hello. Hello.
Hey, hey, check, sound check. ठीक है.
Once again, extending a very warm welcome to all our distinguished members and participants. May I request all those who are standing to please take your seats. We shall be joined shortly now by the distinguished dignitaries for the inaugural session. And just to bring the House to order, may I please request all those who are standing to please take your seats. All these students who are joining us, welcoming you all and requesting you all to please settle down, take your seats quickly. And ladies and gentlemen, requesting you all to please settle down. We are now going to begin with the formal session, the first inaugural session for the day. In a few moments from now, we already have the dignitaries marching towards this auditorium, requesting you all to please take your seats. All those who are standing, drawing the attention of you all and requesting you all to quickly make this place look in order. And we take a minute more, requesting you all to settle down. Ladies and gentlemen, we are now ready to unfurl the formal proceedings for the day, requesting all those who are entering and who are standing at the right extreme end to please take your seats. And ladies and gentlemen, we are being joined by the esteemed dignitaries, the chief guest, Professor V.K. Paul, member health, NITI Aayog, the chief guest. Ladies and gentlemen, with a rousing round of applause, we welcome our esteemed dignitaries, Professor V.K. Paul and Professor Ajay Kumar Sood, the chairperson, Scientific Steering Committee on One Health, the principal scientific advisor to the Government of India, gracing the days amidst a rousing round of welcoming applause. Namaskar. Distinguished gathering of dignitaries, visionary leaders, luminaries from across ministries and departments, esteemed delegates from overseas, policymakers, scientists, academicians, youth representatives, ladies and gentlemen. We are indeed honored and delighted to welcome you all very warmly and heartily to this historic dawn, the National One Health Mission Assembly 2025, translating knowledge to practice. One Earth, One Health, One Future. May we have a welcoming round of applause for that as we raise the curtains. Thank you very much. Deeply etched in our Vedas is the Sanskrit invocation Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, ma kaschit dukbhag bhavet. A prayer for health, happiness, and freedom from diseases for all. Ladies and gentlemen, crafted under the visionary guidance of our Honorable Prime Minister of India, Shri Narendra Modi, and led by the principal scientific advisor to the Government of India, India launched the National One Health Mission. And the National One Health Mission Assembly 2025 is a mammoth initiative that brings together 16 key ministries and departments under one coordinated strategic framework. The One Health Mission is indeed an exemplification of our ancient wisdom, reaffirmed by science, intertwined into policy to translate into action to optimize health outcomes for all. United by this vision, the National One Health Mission Assembly 2025 brings together stalwarts from across sectors, disciplines, and borders to create synergies in strengthening health security and the sustainability ecosystem by solidifying the pillars of pandemic preparedness for humans and animals, integrated surveillance, routine preventive measures, and joint outbreak investigation. So, with those words, ladies and gentlemen, to set the tone and the context of this assembly and to welcome this august house, may I now invite a distinguished physician scientist with over 3 decades of experience in leading health research and translating it into impactful public policy, both in India and globally. Ladies and gentlemen, please welcome Dr. Rajiv Behel, the Secretary, Department of Health Research and Director General, Indian Council of Medical Research.
Respected Professor V.K. Paul, Member NITI Aayog, responsible for health, respected Principal Scientific Advisor to the Government of India, Professor A.K. Sood, my fellow secretaries, international delegates, members of international organizations, scientists from all across India, young students, both from colleges and schools, I would like to welcome you all to this One Health Assembly, which celebrates the establishment of the National One Health Mission under the chairmanship of the Minister of Health and with the scientific leadership and steering of the Principal Scientific Advisor to the Government of India. We are extremely pleased that this mission, which is essentially aimed to help us to be prepared for future pandemics, as well as our current problems of zoonotic diseases, have so much participation across the government with whole of government approach. This involves 16 departments and ministries of the Government of India. And to celebrate that, I'd like to welcome on stage my fellow secretaries Dr. Rajesh Gokhale, Secretary DBT, Dr. M.L. Jat, Secretary ICAR, Indian Council of Agricultural Research, DG, and Secretary of Department of Agricultural Research and Education, and Chairman ISRO and Secretary Department of Space, Dr. to please join me for us to light the lamp together with our chief guest and Professor Sood. And this is a symbol of this lamp signifies that we are looking for this light, this enlightenment to guide us for the future. Professor Mani, also please, Dr. Parminder Mani, Secretary in the Science, in the department, in the PSA office. Dr. Mani, please, may also kindly join us.
या कुन्ते तुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युत शङ्कर प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा
शुभं करोति कल्याणं आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोस्तुते दीपज्योतिर्नमोस्तुते. And that, ladies and gentlemen, marks an auspicious inaugural as per the rich Indian traditions by invoking the blessings and the guidance of the Supreme. And may we thank all the esteemed dignitaries for doing the honors. And now, ladies and gentlemen, we bring to you a kaleidoscopic view of the National One Health Mission journey, the movement encapsulated in this audiovisual. May we have the AV, please?
For over 2 decades, the world has witnessed multiple epidemics and pandemics emerging from the human-animal environment interface. Nipah, swine flu, Middle East respiratory syndrome, Ebola, Zika, and the recent COVID-19 pandemic are strong reminders that the health of humans, animals, plants, and the environment is deeply interconnected and cannot be addressed in isolated systems. Recognizing this global reality and under the guidance of the Honorable Prime Minister, Shri Narendra Modi ji, India has launched the National One Health Mission, led by the Principal Scientific Advisor to the Government of India. The mission brings together 16 key ministries and departments under one coordinated strategic framework. The mission prioritizes intersectoral research and development focused on improving the health of humans, animals, plants, and the environment. Another key objective of the National One Health Mission is strengthening surveillance through technology-enabled system. A technology-enhanced surveillance ecosystem is being developed across the animal-human environment interface. This includes wastewater surveillance in major cities and airports, along with the detection of antimicrobial resistance genes. Surveillance is being carried out across bird sanctuaries, slaughterhouses, zoos, farm, and wildlife corridors, enabling early detection of spillover signals. Advanced tools, artificial intelligence, genomics, and next generation sequencing make this surveillance faster, more accurate, and highly traceable. Another key focus of the mission is accelerating the development of medical countermeasures for diseases with the potential to cause pandemics. Several medical countermeasures are currently under development. Rapid diagnostics, such as TrueNAT for Nipah and Kyasanur forest disease, RT-PCR tests for monkeypox, Zika, and other zoonotic diseases, and monoclonal antibodies for Nipah are advancing rapidly. In addition, vaccines for Kyasanur forest disease, Nipah, Crimean Congo hemorrhagic fever, lumpy skin disease, and avian influenza are also under development. The mission places a strong focus on strengthening India's laboratory capacity by establishing a national network of BSL-3 and BSL-4 facilities across ICMR, DBT, CSIR, ICAR, DAHD, and DRDO. This network of 23 functional high-continent laboratories supports the integrated disease surveillance program in outbreak investigations by testing human, animal, and environmental samples. Personnel have been trained in high biosafety operations, multi-species pathogen diagnostics, genomic sequencing, bioinformatics, and immunology, significantly enhancing national preparedness. Data integration forms another crucial foundation of the mission. A pertinent example of this digital transformation is the National Digital Livestock Mission and the Bharat Pashudhan app, which digitize animal health records, improve traceability, and strengthen monitoring. Likewise, the Integrated Health Information Platform provides near real-time geotagged human health data for early detection and timely response. Together, these platforms unify India's surveillance landscape to support faster, smarter, and evidence-based decisions. When outbreaks occur, India responds as one. Scientists, doctors, veterinarians, forest officers, epidemiologists, and administrators work under a coordinated command. Through the National Joint Outbreak Response Team, ministries converge to contain and control outbreaks swiftly and effectively. A clear testament to India's strengthening pandemic preparedness are the National Health Emergency Simulation Exercises, Vishanu Yuddha Abhyas, and Viral Sankraman Abhyas, drills conducted under NOHM. These drills brought together experts from human health, animal health, wildlife, disaster management, and laboratory systems to test coordination, communication, and rapid response capabilities. Innovations like India's first BSL-3 mobile laboratory, Ramban, now make it possible to deliver high containment diagnostic capability directly to outbreak sites, reducing turnaround time and enabling faster containment. One Health is not just a program, it is a national movement built on awareness, collaboration, and shared responsibility. A healthier nation begins with informed and prepared communities. Through the National One Health Mission, India leads with unity, science, and innovation, protecting tomorrow for one world, one health, one India.
So after that powerful and insightful presentation, the powerful video, time now to make this seminal occasion all the more epochal by a release of an important and a pivotal document. And to do the honors, may I please request our esteemed dignitaries on the dais to kindly release the BSL-3 Laboratory Network SOP Compendium. Ladies and gentlemen, the compendium is a pivotal document that standardizes the procedures for collecting, handling, and testing human, animal, and environmental samples across India during outbreaks. and the distinguished dignitaries on the days marking the release of this pivotal document. By detailing uniform standard operating procedures, this compendium aims to ensure that laboratories in the network adhere to harmonized protocols, thereby enhancing the quality and reliability of outbreak investigations and facilitating coordinated multisectoral response. Thank you very much. And time now. Ladies and gentlemen, it is my distinct honor to now invite a distinguished physicist, an acclaimed researcher, and one of India's most respected scientific minds. Ladies and gentlemen, please put your hands together for Professor Ajay Sood, the Chairperson, Scientific Steering Committee on One Health, the Principal Scientific Advisor to the Government of India, to please address us.
Honorable Chief Guest, Dr. Vinod Paulji, distinguished secretaries and officials from center and states as well as union territories, esteemed representatives from multilaterals and partner nations, colleagues from science, health, environment, and agriculture, friends and partners in the One Health community. A very good morning to all of you. Namaskar. It is a privilege to welcome you all for the National One Health Mission Assembly 2025, a gathering that makes an important moment in India's collective journey towards an integrated, science-led, and future-ready health architecture. In recent years, India has been steadily weaving together what once existed as parallel worlds: human health, animal health, environmental stewardship, and community resilience. The National One Health Mission is the culmination of that effort, a framework that is both a visionary and deeply practical, created to bridge gaps, align capabilities, and connect ministries, scientific institutions, and frontline systems into one coherent fabric. This mission reflects the Honorable Prime Minister's consistent call for a holistic, resilient, and technology driven health system. He has emphasized that a healthy India is the foundation of a developed India, and that our preparedness must extend from villages and livestock to forests, laboratories, and global supply chains. This mission translates this vision into action. What makes today special is not just the scale of participation, which you can see here, but the story it represents. For the first time, 16 central stakeholders, including states and union territories, have come together with a shared purpose. Alongside, we have Youth of India as One Health warriors and global leaders who bring insights from across continents. Today's theme, translating knowledge to practice, One Earth, One Health, One Future, reflects the purpose of our coming together. It underscores the importance of turning knowledge into meaningful action on the ground. One Health, One Earth speaks to our shared environment, One Health to the interconnection across sectors, and One Future to the responsibility we collectively carry. As we embark on discussions over these 2 days, our agenda captures both the breadth and the boldness of this mission. It also reflects the Honorable Prime Minister's vision of an India that is better prepared, more resilient, and capable of safeguarding both its people and its ecosystems. An India that moves from reacting to crises to anticipating and preventing them. I wish you all a very fruitful interaction in these 2 days, and we hope that this mission will take our collective efforts much farther. Thank you very much.
Thank you very much, sir, for your inspirational and sagacious address. It is indeed our privilege to have amidst us as the chief guest a noted persona of deep intellect, the member of the national institution transforming India, the NITI Aayog. Ladies and gentlemen, Professor Vinod Paul, a globally recognized medical scientist and a public health exponent. And it is our proud privilege to now invite you to please address us, sir.
Thank you. Namaskar, good morning. Respected Professor Ajay Sood, Principal Scientific Advisor to the Government of India, very distinguished and esteemed secretaries of different departments and ministries, Government of India, distinguished invitees from the state governments, our partners, UN partners, and other fellow travelers in global international health, and above all, the delegates representing the entire nation. Today is a beginning of a Jan Andolan for preparedness for future challenges in health of humans, wildlife, and domestic animals, and indeed the environment as well. It's an honor for me to join all of you today at the National One Health Assembly 25, a platform that truly symbolizes the spirit of integrated health and whole of society collaboration. Today we gather not merely as individual sectors that we represent and that we have expertise in, but also as one unified ecosystem committed to safeguarding the health of our people, our animals, and our environment. In this endeavor, in the endeavor of National One Health Mission, we draw inspiration from the Honorable Prime Minister's call for One Earth and One Health at G7 convening in the midst of global COVID-19 pandemic on 12th June 2021. He said, we have a shared future, and these challenges have to be met through the mantra of One Earth and One Health. As we meet here, we all continue to face complex health challenges, zoonotic diseases, antimicrobial resistance, climate-driven health shocks, and ecological imbalances. These threats do not respect borders, sectors, or ministries. They exploit every weakness in our system. And therefore, our response to must transcend silos and individual groupings. The One Health approach is no longer an academic ideology. It is a national security imperative, an economic stability strategy, and a social justice commitment, and are very important pillar for attaining a safe, secure, Viksit Bharat as we move forward. India, with its vast biodiversity, large livestock population, dense urban centers, and dynamic environmental transitions stands at the intersection of opportunity as well as vulnerability. We are recognized globally as a potential hotspot for emerging and re-emerging zoonotic diseases. But let me also say with deep conviction that India is fully poised and is capable of mounting a, emerging as a global hub for solutions in this space as well. We are hotbed for challenges, but we are also the place where solutions will be crafted and be made available not only to our own nation but also to the world. The National One Health Mission represents one of the most ambitious, integrated, and future ready frameworks ever created in our country. Under the guidance of the Prime Minister's Science, Technology, and Innovation Advisory Council, chaired by Professor Sood, and through the stewardship of multiple ministries and scientific agencies, India is leading the way in institutionalizing One Health as a permanent pillar of pandemic preparedness and integrated disease control. This is not a temporary project. This is a long term commitment, and we have a stable architecture to take this commitment forward. A critical pillar of this architecture is integrated surveillance. The time has come to break the artificial boundaries between human disease surveillance, animal health surveillance, wildlife monitoring, and environmental data systems. A virus does not differentiate between sectors, neither can our surveillance system, therefore. We are building mechanisms that connect data sets across ministries, across different states and union territories, and indeed across academic and research networks as well. Real time reporting, federated data architecture, and standardized surveillance indicators will allow us to detect early signals of outbreak long before they reach hospitals, homes, workplaces, and schools in our country. Technology enabled surveillance is transforming our ability to predict and prevent disease emergence. AI models, GIS based mapping, satellite linked environmental analyses, and mobile applications for frontline workers are no longer luxuries. They are routine and essential tools of our work today. One of the most important and often overlooked components of One Health is interface surveillance. I'm happy to inform you that a major initiative is already underway in, in ensuring surveillance at slaughterhouses, livestock markets, poultry farms, peri-urban settings, zoos, wetlands, and sanctuaries where animals and humans have a deep and sustained connect. When an outbreak does occur, the speed and cohesiveness of our response determines the ultimate outcomes. India has demonstrated during COVID 19 and subsequent events like the Nipah outbreak that a unified national response, swift national response, saves life. The joint outbreak response framework developed under the One Health mission will institutionalize this approach, and it will combine the strengths of epidemiology, veterinary science, wildlife sciences, environment sciences, laboratory networks, and local authority systems into one single national team. Outbreak investigation, risk communication, containment, and community engagement must be synchronized. I'm so happy to see here communities being represented, and that is why today is the start of National One Health Mission as a Jan Andolan. And indeed, this is a proud moment for our nation. Preparedness requires that our scientific ecosystem stays ahead of pathogens. Medical countermeasures, namely diagnostics, vaccines, and therapeutics, which eventually save lives, animal lives, and human lives, must be available rapidly at a scale. Recently, last year to be specific, NITI Aayog, with the support of all the ministries, launched a report, namely Future Pandemic Preparedness and Emergency Response. Under this report, we provide a pathway for India's 100-day mission for medical countermeasures. We envisage that India will be in a position will be in a position to deliver countermeasures within 100 days, as is the benchmark globally today. We wish to invest in pandemic modeling and forecasting, animal models, diagnostics validation system, clinical trial systems, as well as creating centers of excellence for skilling in this regard. We also envisage reforming and streamlining our regulatory system to ensure that countermeasures are available in the soonest possible time frame. Another pillar of One Health preparedness is our national network of BSL and BSL4, BSL3 and BSL4 networks. We are so happy to see the release of the SOP document today, and this demonstrates that this laboratory system, which originally represents different ministries and departments, has now come together to be able to respond to One Health related threats and for pandemic preparedness. Our endeavors are guided by the philosophy of whole of government, whole of nation, and whole of society. No mission of this scale can succeed without a skilled and empowered workforce. We must build a new generation of One Health professionals, experts who can think across sectors, who understand epidemiology as well as ecology, data science as well as community behavior. Joint training programs for doctors, veterinarians, environmental scientists, microbiologists, and public health officers is essential. We must also integrate One Health thinking into medical, veterinary, and environment science curricula nationwide. And we must invest in training of our frontline workers, Panchayati Raj institution members, municipal staff, animal handlers, and so on, because they all could be the first responders. States and local governments are the real implementing engines of One Health. While national frameworks provide direction, it is the states that translate policy into action. I strongly encourage every state to establish a state One Health platform that brings together multiple departments like the national network, like the national convening that you heard about, and ensure data sharing and be prepared for joint response. At the same time, going further, we will need district level One Health units and cells. That's the work to be done for integrated surveillance and rapid response. India has a unique opportunity to lead One Health paradigm in the world. We bring to the world a model of One Health that is affordable, scalable, and inclusive. Through the G20 process, WHO collaborations, South South partnerships, and knowledge exchange with other countries, India offers to foster One Health security for all nations. As we stand here, I would like to call upon ministries, scientific agencies, state governments, and community organizations to commit to a shared outcome, that is, the health of our people, health of our animals, and indeed the health of the environment. Let us ensure that every discussion in this assembly translates into measurable action, whether it is surveillance, research, workforce development, or community empowerment. In closing, let me emphasize that One Health is not merely a framework. It is a philosophy, a duty, a promise, and an endeavor. A promise that we make to our children and to future generations. A promise that we build a safe, healthy, and resilient India by working together, guided by uh, the visionary guidance that we receive from the Honorable Prime Minister. Let us move forward with determination, unity, and a shared vision for one earth, one health, and one future. Thank you very much. Jai Hind.
Our earnest sense of gratitude to you, sir, for guiding us with your exemplary vision and wisdom. Time now for a message from one of the most articulate voices of the government, who's strengthening the health landscape. Ladies and gentlemen, the Chairperson Executive Steering Committee on One Health, Honorable Minister for Health and Family Welfare and Chemicals and Fertilizers, Government of India, Honorable Minister Shri J.P. Nadda. May we have the message played, please?
Good morning and very warm welcome to all of you at the National One Health Mission Assembly 2025. I would have loved to join you all in person, but due to some certain pressing engagements, I'm not able to join this inaugural session physically. This year's theme, Translating Knowledge to Practice, One Earth, One Health, One Future, is both timely and insightful, reflecting our national priorities as well as the broader global health agenda. Over the past decade, India has established itself as a major player in the health research and pharmaceutical sector internationally. Our scientists, researchers, and industry leaders have delivered breakthroughs that have strengthened our nation's health security and contributed to the global well being. India's vaccine leadership has been exceptional. We developed indigenous COVID 19 vaccines like Covaxin, Covishield, Corbevax, and the world's first intranasal vaccine and supplied vaccines to more than 100 countries. We have also advanced next generation platforms in mRNA, DNA, viral vectors, and biosimilars, laying the foundation for rapid responses to future pandemics in the diagnostic sector. India has emerged as an innovation hub driven by advancements in technology, strong research capabilities, and a rapidly growing ecosystem of startups. Indigenous technologies like TrueNAT, PathoDetect, CRISPR based tests, and a growing ecosystem of medtech startups have greatly expanded our capacity for rapid, accurate, and affordable testing. Our clinical research network, genomic surveillance through INSACOG and One Health initiatives are strengthening public health science like never before. The CoWIN platform, developed during the COVID 19 pandemic, demonstrates India's exemplary capacity of developing a high quality database for almost its entire population. One of the emerging examples of India's leadership towards pandemic preparedness is the launch of the National One Health Mission. The mission brings together 16 different central and state ministries, departments related to human, animal, environment, health, pharmaceuticals, science and technology, earth and space sciences, defense, fisheries, agriculture, and disaster management. It is a unique example wherein all stakeholders have pledged to work with each other to protect the health of the humans, animals, environment, and plants. The National One Health Mission is the first of its kind, which showcases India's tremendous strength in pandemic preparedness by collaboration of various ministries and departments. I'm happy to note that the mission has already initiated important activities related to integrated surveillance across human, animal, environment sectors in slaughterhouses, bird sanctuaries, zoos, wastewater, surveillance in major cities of India to track AMR and infectious pathogens, joint outbreak investigations, and development of medical countermeasures. The national network of 23 BSL-3 or BSL-4 labs established under the mission are like the first line of defense for quickly detecting any new or mutated pathogen which can cause outbreaks. The network undertaken as a part of the National One Health Mission will help in integrating efforts to historically improve the health across sectors, identify early warning signals for emerging epidemics and pandemics, and help us in developing focused interventions to be better prepared for the next pandemic. I'm sure that the collective strength of all departments that have been brought together by the mission will yield one of the best outcomes and reassert India's global leadership in protecting health of all. I congratulate all the partners and the stakeholders of the National One Health Mission for organizing this conclave, which will provide a valuable opportunity for people coming from different streams to interact, share scientific knowledge, and collaborate. I wish success for this conclave. Jai Hind.
And as we embrace those pearls of wisdom from the Honorable Minister, may I now invite Dr. Nivedita Gupta, the National One Health Mission Coordinator from the Indian Council of Medical Research, to kindly deliver the vote of thanks. Ladies and gentlemen, with a welcoming round of applause from you all, Dr. Nivedita Gupta.
Very good morning to one and all. And it's really a proud privilege for me to offer this vote of thanks on behalf of the National One Health Mission. I would first of all sincerely like to thank the Honorable Minister of Health and Family Welfare and Chemicals and Fertilizers, Shri J.P. Nadda ji, for his very encouraging remarks at the beginning of this conclave. Though we dearly missed his presence during today's event, but his encouraging words would really instill adrenaline in all of us, and we will work towards the success of this mission. I would also like to thank sincerely Dr. Vinod Paul. So, your enthusiasm and your encouragement always helps us to set the bar higher and higher. And your visionary leadership really helped us to do quite a bit of things during the pandemic. And we look forward to your continued guidance to steer the work of this mission as well. I would also like to thank PSA sir, Dr. Ajay Sood. Sir, your visionary guidance and leadership has really put us in a place where India is now in a position and steering one of the most unique One Health, I would say, landscape in the world. So thank you very much, sir, for your visionary leadership, your continuous guidance and hand holding. I also would like to specially thank all the secretaries who have come from various departments. My special thanks to Secretary DARE and DG ICAR, Dr. Mangilal Jat sir. I would also like to thank Secretary Department of Biotechnology, Dr. Rajesh Gokhale, for being a very pivotal part of this mission. My sincere thank you to Secretary Department of Space and Chairman ISRO, Dr. V. Narayanan, for coming here, sir. And also I would like to thank Dr. Rajiv Behel, Secretary Department of Health Research and Director General ICMR, for his visionary guidance and his passion to take the activities of this mission in a very integrated and collaborative way. I would also like to thank all the departments which are a key in the cogwheel, I would say. Department of Animal Husbandry and Dairying, Ministry of Health and Family Welfare and NCDC, Ministry of Environment, Forest and Climate Change, Ministry of Earth Sciences, then Defense Research and Development Department, National Disaster Management Authority, Ayush, Department of Pharmaceuticals, Department of Science and Technology, Council for Scientific and Industrial Research, Ministry of Fisheries, then all the state governments and representatives from the Directorate General of Armed Forces. I would also like to thank various international speakers and participants who have really taken pain to help us and support us in this mission. My special thanks to Dr. Tedros Adhanom Ghebreyesus for sending DGWHO for sending us a recorded message, which you will hear in the subsequent sessions. My thanks to Dr. Alu Dohong from FAO for attending this meeting. I would like to thank Dr. Semmate from the World Bank and Dr. Hikupi from World Bank for joining us and gracing this occasion. I would thank Professor Jane Halton from SEPI for sending her recorded message. We missed her presence as she could only get the visa at the last moment. My heartfelt thank you to representatives of embassies from the US, UK, Italy, Norway, Switzerland, Finland, and France, colleagues from WHO, CDC, FAO, other national and international agencies for joining this. And I would fail in my duty if I don't thank the chairs of various committees under the National One Health Mission, Dr. Madhuri Kanitkar, Dr. Renu Swaroop, Dr. Chandru, and Dr. N.K. Arora for steering various committees on medical countermeasures, the network of labs, data, and surveillance, and guiding the activities of this program. I would also like to thank Dr. Parminder Maini for her continuous engagement in the activities of this mission, and all the colleagues from VRDLs, IRDLs, MRUs, MRHRUs, directors of ICMR institutes, independent researchers, colleagues from industries, innovators, independent experts from various departments. And I would earnestly and specially like to thank our young colleagues who have joined from various schools, colleges, as well as from various parts of the country, the hackathon winners. We are really very grateful to you and look forward to continuously engage with you under the National One Health Mission, and look forward to having you as sentinels of this mission so that you could inform your state health officials whenever you see anything wrong or anything unusual happening in the environment, people, or animals around you. So, very warm welcome to each one of you, and thank you for joining. And finally, I would like to thank the additional DGs of ICMR, Dr. Sangamitra Pati and Dr. Alka Sharma, the senior leadership of DHR ICMR, uh, uh, Anu Nagar Madam, Dr. Richa Koda Madam, Richa Pandey, Manisha Saxena Madam, Dr. Pragya, who's the director in charge of the National Institute of One Health, Tusharji, Jagdish Rajeshi, and the entire organizing team. And the list is long. I want to thank each and everyone who has helped in making this conclave happen. And if I have missed anyone in this room, I'm really my apologies. But I sincerely thank each and everyone who's sitting in this room and has worked behind the scenes to make this conclave happen. Thank you very much.
Thank you very much, Madam, for that warm vote of thanks. With that, ladies and gentlemen, we culminate the proceedings of the inaugural session, and time now for us to express our earnest sense of gratitude to the distinguished dignitaries on the dais with a resounding round of applause for gracing this epoch-making morning with their gracious presence and wisdom. Thank you very much. Ladies and gentlemen, the multi-purpose hall now awaits you for a hot sip of tea coffee, requesting you all to kindly use the rear exits and kindly allow us to use these exits for the esteemed dignitaries. Also drawing the attention of all our dear students, requesting you all to please stay back with us. Your role has already been highlighted, and we request you to please stay here in this auditorium with us. And requesting everybody to please reassemble on time. We have the next session commencing at 11:45. Thank you very much. Enjoy your break.